This is the first day of my 4th year technically, and I just placed my first suture.
Hold on a sec. I'm actually closer to the end of my 4th year and I'm about to graduate as a dentist in just a couple of months. Let me tell you, 4th year is confusing and it's scary. Everyone will be asking you about your future plans after graduation, and it sucks to not know. It sucks to think that you know and then be rejected. This vlog is about periodontics. I was so in love with the specialty, but I decided that it wasn't for me because it would be too hard on my hands and my body. I'll be okay. There are other better fitting specialties out there. For now, let's reminisce on a time in my life when I was exploring perio specialty. Spoiler alert, I didn't apply. For those of you who are considering perio, I hope this video gives you an insight into what periodontics is all about.
Hey guys, welcome to a new week. It is Monday, May 3rd, and this morning I placed my first suture and it was so exciting. So let me tell you about this week and my day today. So right now it's 5:30 p.m. I just got home, and all this week I have my perio internship. So I'll be down in the grad perio clinic all week, just observing, assisting, attending the lectures that the residents attend, and just learning all about perio. I also have a perio sim lab session on Wednesday where I'll learn how to suture on typodonts. And then Thursday and Friday, I actually have other rotations, so I won't be in the perio clinic full time. But I'm super excited for this week because I've been looking forward to this internship. Every single time I shadow down there, it's exciting. It's a lot cooler than the second floor to me. I just really like surgery. I can definitely see myself doing just perio surgery for the rest of my life, but I'm not completely sure, so I'm not going to apply to perio residency. But for now, I still want to learn as much as I can, so I'm going to learn as much as I can, and hopefully if I don't apply to perio residency, I'll still be able to do some perio surgeries as a GP dentist, a general practicing dentist. I think that's what GP stands for. So today in the morning, I watched an osseous surgery, and in the afternoon, I also watched another osseous surgery. I assisted the same doctor, Dr. Ko. She's great. I learned a lot. So let me tell you a little bit about what osseous surgery is. So these patients had deep pockets. They already went through 4 quads of scaling and root planing, and the next step in order to reduce those deep pockets would be some periodontal surgery. And normally it is osseous surgery. So we opened up a flap. The first patient, we opened up a flap. The doctor used a cavitron to debride the teeth. And then we did the osseous surgery, which was removing some bone. It was called osteoplasty because it wasn't supporting bone. So it's just removing some bone so it recontours better so the gingiva can lay on it nicer. And this will reduce the pocket depths. She did a continuous sling suture to suture all the teeth back up, and then she let me do a simple suture at the end, at the very back. So after the last molar, she let me do a simple interrupted suture, which was super exciting because that was my first time suturing on a human. And then in the afternoon, we did another osseous surgery. This one was, you know what? It was also in the same area. It was also on the maxillary upper left. Yeah, so we did the same thing, and then we sutured it up, and that was it for the day. So tomorrow I have a lecture with the residents at 10 a.m. and it's in person, my first in-person lecture. And then in the afternoon, I'll be assisting a different resident, and we're going to be doing a bone block procedure. I assisted this procedure one time, and it was like super complicated and looked really difficult, but it was also super cool. So the last time I assisted this procedure, they took jawbone from like the back of the jaw and then placed it a little bit forward so the patient can have enough bone in this area to get an implant placed. So I don't really know why we're doing the bone block tomorrow because I haven't seen the patient's mouth, but it's going to be a similar procedure. We're going to move bone from one area and move it to a different area of the jaw. So tomorrow's going to be cool. It is Tuesday. It is the second day of my perio internship. This morning at 10 a.m. I attended lecture with the residents, and that was fun and exciting because I got to see how all of them interact. They're pretty fun, and it's cool learning what they're learning. So today we learned a lot about emergency medicine and learned about EKGs. This afternoon I'm gonna help with a sedation case. I'm pretty sure it's a sterile case, so I'll be able to scrub in, which is exciting in itself. It's gonna be a moderate sedation case, so I'll be learning about the medications used things like that. I'm excited. I just got home. What a day. I got done at school at 6 p.m. It was a crazy day. It was a crazy surgery. So the surgery we did today in perio was a bone block. We took a piece of bone from the mandible, from the lower left quadrant, and then placed it up here on the maxilla, on the upper right quadrant. It was crazy. So I have seen this procedure before, and the first time I saw it, I was like, whoa, this is the coolest thing ever. It is kind of the coolest thing ever, like seeing the actual mandible just wide open and seeing that piece of bone just being taken out and then screwed into the top. It is a crazy procedure, but it's a really long procedure. Like, I was tired, and I don't know. It seems like a lot of work just to get that tiny little piece of bone up there, you know? I heard not many schools teach this, but USC teaches this because I think it has better healing, better prognosis because it's the patient's own bone. It's an autograft. You can regenerate bone better if you take it from your own jaw and place it somewhere else. So this patient is going to get implants up here eventually. Let me tell you a little bit more about the procedure. So first cool thing is that I got to scrub in. I don't know why that always makes me really excited. I've been watching some Grey's Anatomy, so scrubbing in is exciting for me because you actually scrub with a scrubber like a sponge. You scrub your arms and you scrub your hands, you scrub under your fingernails, and you get all clean, and then you put on a sterile gown and sterile gloves, and then someone like helps you tie it, and then you're not allowed to touch anything. You're only allowed to touch like everything that's sterile. I did file some bone today with like a bone filer. That was cool. Besides that, the procedure involved an incision here, opening up a flap, getting to the bone, filed some more bone away, and then mixed that bone that we filed away with some allograft, and then after the bone block was placed up here, we put that allograft mix with the autograft that we shaved up here, along with a collagen membrane. I know this sounds so confusing, but I just wanted to give you like a gist of what this procedure involved. Oh, and also this was a moderate sedation case, thankfully. So thankfully the patient wasn't wide awake during this procedure because it's just such a long procedure, and like, I don't know, I would not want to be awake for that procedure. So the patient had an IV, and it was cool hearing like all the drugs administered. Some drugs that were administered were midazolam. Midazolam was used basically throughout the entire procedure. That's usually used in moderate sedation cases. And fentanyl, and then another one for nausea and another one for pain towards the end, but I can't remember their names. And then I also remember carbocaine was used to anesthetize the site where we were going to place the IV. That's about all I remember. Oh, and then the heart monitors. I learned how to place heart monitors this morning, so it was cool seeing it like on an actual patient. So one heart monitor goes below your clavicle. This is for the EKG line. So one goes under your clavicle, the other one goes under your clavicle as well, and the last one goes below your ribs. The one under your clavicle is white on the right, the fire and the smoke. There's one that's red, which is the fire, which is the one that goes under your rib, and then the smoke goes on top of the fire. Smoke comes from the fire. That's how you remember it. And then the patient also had oxygen, like an oxygen cannula, I think that's what it's called, throughout the procedure. And there was also a little monitor placed on their lungs, or like by their trachea-ish. We could hear the patient breathing during the entire procedure on like a Bluetooth speaker. So that was cool. I hope that gave you guys a little bit of insight of what perio surgery is like. It was fun. Happy Wednesday. It's another great day for perio surgery. This morning I assisted a perio surgery. We placed 2 implants, one here on the mandible and the other one also on the mandible but on the other side. So I assisted that, and then in the afternoon I'm going to be doing my perio surgery lab session, my sim lab session. But let me tell you a little bit about this morning. I was in charge of suctioning, of course, because I was assisting. I was also in charge of telling the perio resident if he was doing the correct buccal lingual angulation. So that was cool that I was in charge of something. We're back in the sim lab for perio surgery lab.
Wow, being back in sim lab really brings back memories of D1 and D2 year. I just can't believe I'm about to graduate. My dreams are going to become reality. I've made it, and I have to be proud of myself because Lately, I've just been so discouraged because I don't know what I'm going to do after I graduate. But I have to remember that I've made it this far, and worst comes to worst, I get a job as a dentist. I mean, that's why I went to dental school, right? I really do see myself specializing, so first I have to figure out which is the best specialty for me, and then I have to make myself the best applicant and just apply. But for those of you who enjoy surgery, periodontics is a great specialty to go into. It's fascinating, it's fun, it's exciting, and it's less years compared to OMFS, and in my opinion, it seems like it's a little bit more delicate compared to OMFS. I don't know. You guys should check it out for yourselves. I've really enjoyed my time exploring perio.
Hello, you guys. I am so exhausted. It is around 5:30 p.m. I just got done with my day. So after lunch, I did perio surgery sim lab rotation, and that was pretty fun. I did some incisions, I did some scaling and root planing, and did some osteoplasty, and then I sutured the gums back up. It was cool. It was cool to do like my own incisions and my own sutures on a typodont. It was a lot of fun and I really enjoyed it. After perio surgery lab, I assisted again in grad perio. It was an implant surgery. I kind of came late because I had my rotation from 1 to 2:45, so I got there around 3-ish. So first they did a sinus lift, which I was bummed I didn't get to see because I've never seen a sinus lift before. So after they did the sinus lift, they placed 2 implants, both on the maxillary. I think one like in the canine region and the other one in a premolar or molar region. I forget, but it's going to be an FPD bridge. It was a day full of implants, a day full of perio. Good morning. It is Thursday. It is about 10:30 in the morning. So this morning I logged into a Zoom lecture with the grad perio residents. They just had like a group meeting. I only did that for 30 minutes because I had another rotation at 9 a.m. on Zoom. It was hospital dentistry rotation. So I logged on Zoom and we learned about what it's like to do hospital dentistry. So basically patients being under general anesthesia, being intubated through the nose. Hi guys, so it's been a very long day. It's 7 p.m. I'm actually in my Zoom class meeting right now, but they gave us a 10-minute break. So I'm recording my little video right now to update you guys on my day. I have my pressure pot with me because I was in the middle of making a shell provisional and then had to hurry back home because I have class, my practice management class on Zoom. That's the pressure pot. Shizzles, shizzles, shizzles. So in here I have a shell provisional that I made. Let me tell you about my day now. So in the afternoon, I assisted in grad perio again, and I watched a soft tissue graft and a frenectomy. I've watched a frenectomy in oral surgery before, but this one was different. This one, they took a little bit of soft tissue from an area, so from the maxillary like tuberosity area, and then they removed the epithelial layer. So then they only had the connective tissue, and then they put that connective tissue by the frenum. So they like made an incision on the frenum to make the frenectomy, to make the frenum longer, and then they sutured in some connective tissue in there as well. And the whole point of that was so the fibers don't reattach to the bone, something like that. I don't know. All this is kind of new to me. It is Friday. We made it to Friday. Yes, it is still an accomplishment to make it to the end of the week because on Mondays and Tuesdays, I'm always like, how the heck am I going to make it till the end of the week? But we did it. We basically did it. Just one more full day of school. So this morning I have a Zoom rotation. I have my URM clinic rotation, which I think stands for Union Rescue Mission. So every Friday I'll be going to an outside clinic and doing dentistry. But the first week, which is today, it's just going to be on Zoom and we're going to learn about RPDs. RPD stands for removable partial dentures. So I'm assuming at these clinics we're going to be doing RPDs or something like that. I don't know. This is my first time doing this rotation. I'm excited though because I heard that we get to do a lot. By a lot, I mean like a lot more fillings. You see a lot more patients instead of just 2 patients a day. You'll see them like every hour, every 2 hours. I'm not sure how it works, but I just heard that it's a really cool rotation, so I'm excited. So after my Zoom rotation, I am gonna go assist in grad perio again for the last day of my internship. I'm really hoping I get to suture again because I want to practice the most suturing that I can on a real patient. All right, so we're taking our first 10-minute break from our Zoom lecture because this is a long lecture. We're reviewing RPDs. It's pretty refreshing because I still don't really like removable. I just didn't really have the best experience. COVID happened. I didn't really finish my removable class to begin with because of COVID. Doing this review on Zoom is actually really helpful, and I'm actually understanding everything, and it feels nice to understand things. Something that I'm also doing right now is taking care of my friend's dog. This is Zeus right here. He's just been sleeping around. He was also on my lap while I was on my Zoom lecture, so that was a lot of fun. I love puppies and dogs. Oh, and I'm getting a dog soon, June 12th. It's pretty official. The dog is born. I'm so excited to pick up the dog. It's gonna be a puppy, but yeah, more on that later. I don't want to jinx it too much, but I'm so excited. I've been waiting since December for this puppy.